With our Dutch nationwide pregnancy-associated breast cancer cohort, we have tried to gather all patients with pregnancy-associated breast cancer, which is commonly defined, and within our cohort at least, it's breast cancer either during pregnancy or within 1 year postpartum. And we also included patients within 1 year after an interrupted pregnancy. In total, we were able to find between 1988 and 2022 about 787 patients who met these criteria, and we actually also compared them to a non-PPBC control group, so of other young non-pregnant breast cancer patients. And what we found was that, well, first of all, we compared our PPBC patients to our non-PPBC patients, and what we saw was that we see a more aggressive histopathologic profile in PPBC. So we see more often grade 3 tumors and more often triple negative tumors, for example. And when we then look at the prognosis, we also see a worse 5-year overall survival for the PPBC group compared to the non-PPBC group, where the difference in survival is about 8%. So it's 77% compared to 85% in the non-PPBC control group. So we see worse prognosis for the PPBC patients. And that led us to wonder actually what causes these survival differences. So what we did then is we looked specifically into the PPBC population to see if we could find subgroups who were responsible for this worse prognosis. And that led us to the discovery that the aggressive histopathology is a lot more common in patients diagnosed in the 2nd and 3rd trimester of pregnancy and shortly postpartum. So that especially the patients diagnosed in the later pregnancy or shortly after childbirth really had the aggressive histopathologic profile and a worse prognosis when we compare them to the patients diagnosed very early in pregnancy, in the 1st trimester, or after a longer period after childbirth, after the 6 months. And also there's a big difference in the survival, because then for the unfavorable group, so later in pregnancy and shortly postpartum, their 5-year overall survival is 67%, which is 88% in the more favorable group, which is early in pregnancy and later after childbirth.